Going live with 4C Scuba Shop.
Hey 4C divers! Welcome to Facebook Live. Thank you for tuning in. If you are listening to us, please tell us hello and tell us where you're listening in from. Are you here in Florida? Are you outside of Florida? Are you in another country? We want to know. How's everybody doing? Are you guys ready to dive this summer? We are. The water is nice and warm, 82 degrees. We have great viz. We have boats, we have shore dives, we have the Blue Heron Bridge. We have everything you need to go diving. So come on down here to South Florida. Come and look up 4C Scuba, and we'll get you out there and we'll go diving together. So we have a fantastic presentation planned. So before we start, I want you guys to give us the thumbs up, the heart emoji, or the smiley face. Let us know that you're listening in and you are liking what you are hearing. We are going to be raffling off at the end of the presentation a $50 gift card to 4C. Woohoo! So make sure that you go to our Eventbrite link that is at our website, www.4-e.com. Go to the event tab and find tonight's presentation. Make sure you register with your correct email so that you can be put in to our online raffle later this evening. I will be closing that registration at 6:45, so you have some minutes to get over there and come back over here and listen to our diving ENT doctor. So everybody saying hello. Everybody say hi to our guest presenter. We've got Dr. Grobman on. Hey, doctor. How's it going?
Awesome. So excited to be with you, and I appreciate everyone who signed in and wants to learn a little bit. So thank you guys so much for joining.
Awesome. So we have a great presentation for you guys with a fantastic doctor, and I'm also a dive instructor. So we're going to talk to you guys about ears and sinus while scuba diving and free diving, because you have to consider both sports when it comes to ears and sinus. So let's go ahead and start. So Dr. Grobman, tell us a little bit about yourself and let everybody know who you are.
Well, my name is Ariel Grobman. I'm a second generation ENT doctor in South Florida, and my father actually was a scuba diver as well. So I guess I got the water gene from him. I've been an ENT in private practice for about 3 years. I've been scuba diving since the age of 15. See that my aunt joined. She took me diving when I was 15, 16 years old. And I'm a very avid diver. I love the water, frequently fishing, diving, surfing. So my passion is in the water. And I, in recent years, have been able to tie in one of my favorite hobbies with my subspecialty, which is being an ENT doctor. And being an ENT, as you'll see in a few minutes, we have a lot of pressure issues that we have to deal with and water issues that relate to our anatomy. So it's been really cool marrying both my passion and my specialty as a doctor. And I love helping divers get back in the water and help people who have had issues become divers. So it means a lot to me to be able to talk to you guys today.
Okay, awesome. So go ahead and give us a quick physiology of your ear and sinus so we understand when you're talking about things tonight, what the mechanics are for our ears and sinuses.
Yeah, for sure. Thanks. So first of all, we need to understand the ears and the sinus as closed cavities in the head. Okay, we have air spaces that give us issues. They're very important, and we'll talk about them individually first. So let's talk about the sinuses first. I have a little diagram for you guys to kind of explain some things, okay? So the sinuses are structures in the face with air spaces. Now we have several of them, and they're represented by the different colored areas in this diagram. So we've got paired sinuses, meaning one on each side, and they have a lot of function for us for moving around mucus, for preventing trauma to the important organs in our face, like our eyes and our brain. But sometimes they give us problems when things get trapped in there. So these air spaces, they drain through small little areas, and they ultimately empty out into the nasal cavity. Now, in the face, we've got the blue ones, which are the maxillary sinuses, which are in our cheek in this area and under the eyes. We've then got these yellow ones are called the ethmoid sinuses, and they're in between the eyes, and they cause pressure sometimes right in the middle of our faces. And we've got the frontal sinuses, which are these red ones, which can give us pain and pressure over the eyes if we're having issues. And then finally, this one a little bit deeper back, this green one, that's called the sphenoid sinus, which can give us a more deep type of pain if there's any congestion. So those are the paranasal sinuses in a nutshell. And because they have air inside them, if there's any clogged drainage of the mucus, then we get trapped air. And as we'll see soon, trapped air under pressure can lead us to having some problems, okay? So that in mind, let me just touch on the ear real quick before we move on. So the ear also is full of trapped air spaces. Now we have the middle ear, which is right in this area, where we have some very important bones and the access to our inner ear, which we use to hear. And as you guys can see, the ear canal here, the eardrum has been removed. So just for the sake of explaining things. Then we've got the eustachian tube. This eustachian tube connects the ear to the nose. So everything's actually all connected. And this eustachian tube helps ventilate the middle ear so that the middle ear has air in it at all times. If the ear is not ventilated with air, then we can't hear properly. But as all of my divers know, the eustachian tube is extremely vital to equalizing pressure between the external atmospheric pressure going on in the water and our pressure inside our body. So understanding these air spaces and how air can get trapped in them is key to understanding how we can dive safely and what happens to us when we have accidents from diving. So that's my quick little anatomy explanation. One final thing to touch on is the inner ear. The inner ear, or the cochlea, is this organ right here. It's deeper inside, and it relies on very, very sensitive fluid that's inside of it. Now, if you have pressure and problems with equalization, and pressure builds up and it gets transmitted into the cochlea, then we can suffer hearing loss and we can suffer balance problems from barotrauma. So we've talked about sinus and paranasal sinus anatomy. We've talked about the middle ear and how the ear stays ventilated. And finally, the inner ear and how we get problems with hearing and how we get problems with balance from barotrauma. So that's, in a nutshell, Nicole, the anatomy of the ear and the sinuses.
Okay, so let's go ahead and move then to this next slide here. There we go. So why is it important to know about these air spaces while diving? So basically, we need to know for two reasons. We've got people who scuba dive, and we also have people that free dive. If you're not familiar with the term free diving, basically it's someone without a scuba tank who holds their breath and they dive down and then they come back up on one single breath. And scuba diving obviously is when you're consistently breathing. So why are these air spaces important? Well, because when we're diving, pressure will be exerted onto your body, and you need to be able to relieve these air spaces as you go down. So if you look at this diagram, if you are a certified scuba diver and you took the class, you would have seen this diagram in one of your books or one of your digital courses. And what you're going to see is at the surface, you have a pressure of 1 atmosphere, and basically that balloon, that red circle right there, think of that as the airspace. And as you dive down, it's going to start to squeeze, and you actually will see a pressure change every 33 feet of depth. So 33, 66, 99, etc. So what happens is your airspace will squeeze down, and then as you come up, it will go back to the original size. As a scuba diver, your lungs are consistently breathing, so you actually don't get that squeeze, and you're actually equalizing your lungs. But your ears and your sinus is an airspace, and this is what it's doing. It's basically squeezing down that airspace, and then as you come back up, you are going back to original size. So you really only have to equalize your ears and your sinus when you're going down, descending. As you come up, you shouldn't have to do any type of equalization. So looking at this chart, think of your ears as this balloon. So if I need to equalize, I'm going to make sure that I get a good equalization and I don't hurt myself when I'm diving. So hopefully this this chart helps you guys understand the pressures at the body that the body are being exerted against when it comes to diving. And this is for both free diving and scuba diving. So let me move to the next slide here. So there is some pre-dive preparations that you can do to help yourself get ready to go diving. I always tell people, hey, I'm a scuba diver and I'm a dive instructor. And what happens for me is I am diving all the time. So I'm constantly prepping my body to do these types of, diving when I'm diving with students or I'm diving with other certified divers. But then there's the people who don't dive as often as me. So there's definitely things that you can do to make sure that you're getting yourself ready for maybe a local dive, or maybe you're going to go and travel and go to another country or come down here to South Florida, and you're going to be doing multiple days of diving. You need to prepare your sinuses and your ears for these activities. So the biggest thing I can tell you is to hydrate. Hydrate, hydrate, hydrate. I took my freediving course, and that was the biggest thing they told me is if you are dehydrated, it's going to be harder for you to, do some equalizations and get that clear out of your sinus, because you don't want anything in there. So when we clear out your sinus, I'm going to let you, doctor, tell people about some things that they can do to clear out the sinus. What kind of rinses and techniques do you have for that?
Yeah, for sure. And I totally agree with a lot of the things that you just touched on. Hydration is extremely important. One thing is, before a dive, just listening to your body. Sometimes, as you mentioned a little bit later on in the slide, if you have a cold, reschedule your dive. If you're not feeling right and you're not able to equalize on land when everything is in normal atmospheric conditions, then you're probably going to have issues when you're under immense pressure under the water and things are getting harder. So you really need to listen to your body. And this is especially difficult for people when they're on a dive trip, when they're on vacation. I've been there, and it's really, really, the pressure's on. You book this whole vacation, you really, really want to dive, but you've got a cold, you're having a sinus infection, and you just don't know what to do. I always remind people, if you push the issue and you go dive when you're not able to equalize, you're having an active sinus infection, you're going to regret it. And you're going to regret diving more than you would have regretted canceling and rescheduling the dive. So first and foremost, listen to your body, and then listen to your instructors and your doctors, etc., because everyone's a little bit different. Now, in terms of prep ahead of a dive, I recommend taking decongestants up to 48 hours in advance. One thing that people sometimes overdo is using nasal spray decongestants like Afrin or other over-the-counter ones. Why? Because they actually become addicting, and our noses, when we're not using them, they actually get more swollen. So I would be a little bit wary of using the nasal spray decongestants like crazy, but things like Sudafed 2 or 1 day before diving is totally fine. For people who've got chronic issues with allergies or sinusitis, using Flonase, like a steroid nasal spray, a few days in advance is a really good idea. And then you want to use saline rinses, okay? Why do we not use water, like distilled water alone? Is because when we put water into our body, it actually dehydrates us. It actually takes salt from in our cells and our tissue, and it takes it out. You want to use saline because it's isotonic, or it's the same concentration of salt as in our body, as in the solution. So it doesn't dehydrate you. It does just the opposite. It rinses out the mucus and the bacteria in our nose and in our sinuses, and it can actually physically remove that mucus, thereby opening up the drainage of the air spaces that I mentioned to you guys with the diagrams earlier. So saline, listening to your body, using decongestants, and then the most important thing that you can do is flex your muscles. What do I mean by flex your muscles? Flex your eustachian tube muscles, okay? Equalizing, equalizing, equalizing. I tell people to equalize 10 times an hour sometimes, okay, if they have problems. 20 times a day, 30 times a day. You're not going to overdo it. If you have resistance and you feel resistance, then you should stop. But that doesn't mean you shouldn't try again. So I tell people, think about equalization like a steady increase of pressure like that, not to force it super hard, but really gradually increase the pressure until you can get those eardrums moving in and out. Because remember, we're forcing air up through this tiny little duct, the eustachian tube, and if there's any swelling in there, it's going to take some force, and you're really going to have to work on it. So you want to put in the work ahead of time, right? You want to work on it on land. So day before a dive, night before a dive, you know, talk to your family and friends, enjoy your dinner, but equalize the entire time, and be equalizing the day of the dive while you're prepping your gear, just so you have no problems. You're not going to overdo it, but you certainly can underdo it.
Awesome. And that's what I tell my students. You guys, if you've ever taken a class with me, I always tell you, you have homework. You got to go home, lay in bed at night, and do your equalizations at night. And then again in the morning when you wake up, so that way your ears are ready. Because, you know, you're not going to go and start running a few miles without stretching your arms and legs first, right? So if you're going to go diving, you need to stretch your eustachian tubes. So that's a great tip that you have there, doctor. Okay, so let's go ahead and look at what it takes during the dive to help your ears and sinuses. So during a dive, we want to equalize early and often. What I usually tell my students is if you're going down a line and you're pulling yourself along the line, I always say every 2 pulls, equalize. Every two pulls, equalize. And if you're not using a line to go down, maybe every 2 breaths, equalize. Equalize early and often before you ever feel the pain or a little bit of resistance. Because once you get to the pain, it's actually harder to equalize. So, Dr. Grobman, do you have any comments about that?
Yeah, I totally agree with you. I just want to reinforce that. Equalization should take place probably every 3 to 6 feet. In anyone who's had previous issues, be it ear infections with possibly some scarring within the ears, or eustachian tube issues that are chronic with pressure issues, sinonasal issues, you really want to go slow and equalize very, very frequently. And as you mentioned, once you start getting some pain with equalization, what's happened is that eustachian tube has probably already built up some edema or some swelling in there. And then when it's swollen and it's gotten to the point where the pressure is pushed against your tissues, it starts to cause some swelling in there. And then you get swelling of the lining, the sensitive lining of your eustachian tube and of your ear, and it makes it harder to continue equalizing. So you want to stay ahead of problems. This is an issue where you got so much riding on this. Whenever we go diving, be it free diving, free diving with spear fishing, or scuba diving, we're all there to have fun, to see a lot, to interact with wildlife, and to spear and catch fish. And you want to be super, super prudent about equalizing properly so that you don't ruin your fun day out on the water. So you really want to be obsessive about that. And then I recommend, if you feel some tightness, never ever force it. What you want to do is ascend a few feet, actually, because if you remember from that balloon analogy that Nicole put up there, we've got extra squeeze on these tight air spaces as we descend. And if we go up a little bit, that pressure is relieved. So you're going to have a better chance fixing your eustachian tube equalization problem if you ascend a little bit, get that ear popping, come down a little bit more slowly, and then get it again. So never ever push through a block, because you're going to ruin your fun day on the water. And then unfortunately, you're going to have to come and see me in the office.
All right, that is true. So what are some equalization techniques? There's some different ones that people use. With scuba, the most common one that people are taught is the pinch your nose and blow gently against the pinch. And that is called the Valsalva method. Did I say that right?
Valsalva, very close.
Valsalva. Okay, so that's the Valsalva, pinch your nose, blow gently. So everybody at home, do it for me right now. Everybody pinch your nose and blow gently.
Do it. Let's do it. Everyone together. I usually tell people, grab your nose and try to force air that's in your nose into the back of your head and get those eardrums moving. So I want everybody to try it on Facebook, Eventbrite, and on Instagram to do equalization right now.
Everybody do it. There you go. All right. Another technique you can do is you can wiggle your jaw back and forth. Okay.
Not on an airplane when you're chewing gum to try to open up your ears from the pressure. That's what you're doing.
Yep.
You're wiggling your jaw and opening that eustachian tube.
And another one I tell my students is try swallowing your breath. That one is an easy one to do, and that usually helps move those eustachian tubes as well. It's kind of a similar method that free divers use. If you are a free diver, you've heard of the Frenzel method. Basically, that is when you fill up your mouth with a little bit of air, move the soft palate to your epiglottis with the tongue, push air towards the back of your throat. And so basically, I've actually been taught you kind of give a little like noise when you do this. So if you want to try it with me, it's kind of like a grouper grunt. If anyone has a spearfishing or have you ever heard a grouper, they kind of like make this grunt noise. So it's like this. I don't know if you can hear me. Did you hear me, Dr. Grobman?
I did. I haven't heard a grouper grunt at me yet, but I would imagine that's what it sounds like.
Yep. So that is the Frenzel method. And the reason why freedivers use that method over the pinch your nose and blow is because when you're free diving, you only have the breath that you took at the surface. And so as you dive down, you don't have a lot of airspace to equalize. So you have to use that method to equalize. And you have to do it even more often as a free diver because you're going faster as you go down. As we descend, we usually go slow on scuba, or if maybe you're trying to hit a wreck, you're going fast. But most of the time we're going nice and slow. And then free divers are going fast as they go down. Now, just another thing to remember is it'll be easy for you to equalize your ears if you stay, as a scuba diver, if you stay with your feet to the deep, the depth, the reef, the wreck. So basically, if you keep your head above your feet, because again, with that method of, the higher point is going to have less pressure. So as you go down, just keeping your head up, and that's going to help with the equalization. And sometimes I've also noticed that if you are trying to dive down with your head down and you equalize, you could get a little bit of disorientation. And so if you're doing that, you want to keep your head up. Free divers, the free diving instructors I've taken classes with, they teach you to, if you are going to free dive down, to not look at the where your destination is. So don't look down the line if you're doing line diving, or if you're trying to go to a reef or a wreck. You don't look up. Actually, if you're hearing me right now, you'll hear a difference in my voice. When I'm looking up, you hear a different tone in my voice versus when I'm here. So when free divers go down, they actually they're not tucking their chin completely, but they're keeping their head parallel with their chest and not looking like this, because this is going to make it harder for them to equalize. So just a little bit of tips and techniques on equalization. Anything else you wanted to add to that, Dr. Grobman?
No, that was awesome. That was totally complete.
Awesome. Okay, so let's go ahead and look at some of the gear. We're just going to touch briefly on, there's a few items out there that could possibly help you if you do have equalization issues. There is a mask. 4C, we carry this mask, and it's basically cups that go over your ears that have a tube that goes to the mask. And so basically it allows you to not get the rush of water in your ears. If you're someone who's very prone to ear infections, this is a great option for you to help with diving. I've had, mixed reviews on this one. If you are not wanting to give up your mask because you have the best mask in the whole entire world and it fits your face, then maybe try what is called a Dox Pro plug. Dox Pro plugs are not earplugs. They are actually vented. So that way there is a little pinhole and the water can go into your ear so that you can still equalize. We sell these at 4C and they come in different sizes. So you can come in and one of our associates can fit and see what size ear you might need. I'll be honest, guys, I have to dive with my Dox Pro plugs. If you've ever been on a dive boat with me, you see them in my ears. I literally have them on every dive, even when I'm in the pool when I'm teaching, because if I have an issue, it's usually because I get too much water too fast in my ear and it doesn't help me. I have a lot of ear pressure. Actually, we didn't say this in the beginning, but I actually go to Dr. Grobman. If you guys all want to know who I see, I go to him. We've got some other people at 4C that go and see Dr. Grobman as well, because we want to keep our ears healthy. And because he's a diver, he understands it. So, but going back to the Pro plugs, this saves my dive because I'm able to equalize nice and easy, and I don't usually have any issues. So those are just some common gear that you could potentially get. And we carry them here at 4C. So if anybody wants to come in and learn more information about it, come see us. Okay, so after the dive, this is literally the photo of after my dive today.
You should show this on Instagram too, because this is the best photo I've seen in a while.
All right, so after the dive, you definitely need to consider clearing your ears out. For me, if I do not do this, then I will have issues and then I won't be able to go diving and give you all these great dive reports that you guys see. So this is me today, but basically, Dr. Grobman, what are some of the solutions that you recommend for cleaning out ears after a dive?
Yeah, so one thing that I want to stress, which I tell everybody and everyone who kind of knows me at this point, is don't stick anything inside your ears. Don't dig around in there with a Q-tip or an ear scooper or whatever. I don't recommend that because you're more likely to cause problems than anything. If you feel that there's some moisture that's built up inside your ears and it's bothering you, the best thing to use is a little bit of alcohol, isopropyl alcohol, rubbing alcohol mixed with some distilled vinegar, or even one or the other, even just a little bit of alcohol to dry it out. It's a desiccating solution. So it'll just dry out a little bit of moisture. A lot of people, they feel that they have things trapped in their ear canal. And what it is they actually have earwax and then they get moisture that's behind the earwax. And then they feel that it's really trapped in there. And sometimes they just actually need to come in for a cleaning. But there are also some products you can use over the counter to break down earwax, like Debrox or some other solutions there, which kind of make the earwax a little bit softer. So I have really no problem with any over-the-counter stuff. I just don't really like when people dig inside their ears because that's when we run into problems. So that's the ears. Talking about the nose and the sinuses, there's a lot of people that encounter nose bleeding, sinus pressure, and pain because what can happen, and also pain tubes, because what can happen is you can actually get air that's trapped inside those sinus cavities, these colored spaces I mentioned to you guys. And when the air gets trapped in there, and the drainage pathways of these sinuses are very tight, then you can get persistent pressure because we have nerves inside the sinuses, and those nerves can be aggravated by that pressure from the dive and still persist for a few hours afterwards. So for people going through stuff like that, I recommend non-steroidal anti-inflammatories like ibuprofen, and also using decongestants, just like the stuff we were using before the dive, like Sudafed or Afrin nasal spray, used sparingly. Saline rinses, Flonase, so really the same stuff that we use before a dive to prepare is what we can use afterwards. But after the dive is sometimes when we run into some problems where people actually need some stronger medication if they're having a bigger issue. So that's when you should really get in touch with your local ENT if you're having problems after diving and things are persisting.
So people are asking about the over-the-counter stuff that's called swimmer's ear. Do you recommend using that?
Yeah, swimmer's ear is totally fine. I think it's fine to endorse it, but also to realize the limitations of some of these over-the-counter products. Swimmer's ear is a drying agent. It's good for drying the ear if there's trapped moisture behind a bunch of wax. I have no problem with it at all. It's not bad for your ear in any way, but it just may not be enough. So if you've tried and tried and tried, and you're having drainage from your ear, or you're having discomfort in your ear, then that's when you should seek the help of a professional, because it may not just be enough to continue the same regimen over and over. But by all means, unless you're not putting something crazy in your ear, and trust me, I've seen that. If you follow me on Instagram or anything like that, you've seen some crazy stuff that I've pulled out of people's ears. If not, you can check it out if you're into that sort of thing. But for persistent issues, definitely go and see a professional.
Well, that just makes me laugh because they have on TLC, I think they have the foot doctor, the Dr. Pimple Popper. They need you. They need an ear doctor to see what you pull out of people's ears. That could be a great show.
I couldn't agree more. Let's do it.
All right. So another question that happens quite a bit is itchy ear. Is there anything that you could recommend if someone's ears are itchy, or is that a sign that you need to go to an ENT and really see what's going on?
Yeah, there's definitely some things that you can do for itchy ears. There's different causes of itchy ears, like having wax buildup. Some people actually who clean their ears too frequently and they have no earwax, they can actually become very sensitive and then develop itchy ears. So stop cleaning with Q-tips. That's the thing that those people can do. Also, there's a lot of people that make flaky skin in their ear. It's like an eczema of the ear canal. They benefit from emollients. Emollients are basically moisturizing agents to put inside the ear, such as baby oil, mineral oil, olive oil. And then there are itchy ear drops, which kind of do the same thing. They lubricate the skin of the ear canal. I would say it's totally fine to try some of those things, like some regular Johnson's baby oil. It works really, really well. You can use it once or twice a day. It's a little bit greasy, so you might want to put a cotton ball in your ear to put in there for a few minutes to prevent it from, dripping out and ruining your pretty shirt or something like that. But those are some easy things that you can try. A little bit of hydrocortisone cream on your pinky put into your opening of your ear canal can be helpful. But again, if it's not getting better and it's bothering you continually, then go seek the opinion of someone who's got a microscope, something high powered to look in your ear, and who deals with not such simple issues. So that's when I recommend seeing an ENT.
Well, it's funny. You say olive oil, and then there's also, to help dry out your ears, you can do a 50-50 mix of vinegar and alcohol, isopropyl alcohol. And it's like having a salad dressing in your ear. So when I run around somebody and I smell that, I go, oh, you must be a diver. Because
I'll share a quick story with you guys about something crazy that I pulled out of someone's ear that could have been on a salad on this topic. Actually, a girl came to see me because she had been trying a remedy for itching ears, and someone told her to put garlic oil inside of her ears. Okay. but she didn't have garlic oil. So I looked inside of her ear, and she had an entire clove of garlic actually in her ear. She had a clove of garlic. So we took it out. It actually caused a little bit of an irritation of the ear. So don't use a clove of garlic. And I threw it away, but hypothetically, it could have gone on this salad.
Oh my gosh. Okay, so let's go into what happens when you have an ear or sinus trauma with diving. So what are some of the, hold on, I just realized I hit the button. Let me go back here. There we go. Okay, so there are a few types of traumas that can happen. There's some serious ones and there's some non-serious. So in this picture here, this is, blood in the nose. And, sometimes what happens when you're blowing is you actually can break a little blood vessel in the nose and the blood comes out of your nose. And, unfortunately with water, it kind of exacerbates, the situation. And it's probably just a little bit of blood, but because of the water, it just intensifies it. So what is your treatment for something like this?
Yeah, so blood coming out of the nose, or a little bit of epistaxis, as we call it in medical jargon, is usually from a small burst blood vessel in the front part of the nasal septum. The nasal septum is that wall that divides the right nostril from the left nostril, and we have really superficial blood vessels that run in that inner nose lining, and they can burst. Now, the good thing is that most of the time when blood vessels burst inside the nose, they're really small vessels, okay? They're not big nosebleeds that are going to go on and on and on and need packing or something like that. And they usually will just stop on their own. So for the large majority of nosebleeds, if you're in the middle of a dive and you somehow notice you have some blood in your nose, what you don't want to do is actually blow your nose, because you're going to increase your intrathoracic pressure in your body, and you're going to create more pressure in your nose. That's actually going to push more blood out of that blood vessel and make you bleed even more. So if you're diving, just leave it alone, continue your dive. If it becomes so much that your visibility is affected in any way, I would say then you can try to do a mask clear, but at that point, if the bleeding is continuing, then it might be time to resurface.
Okay, and so the next one is blood from the ear, usually is some type of rupture, right? So what do we do with that?
Yeah, so I'm going to also touch on after your dive, since too. So if you're having persistent nosebleeds after diving, it could be from the septum, but I do see a lot of divers, free divers especially, but also scuba divers, who suffer some nosebleeds from problems with the drainage of their sinuses. So if you've got trapped sinuses and then you've got pressure injury in there, that's when you get some bleeding from the lining of where the sinuses drain out of. And that's when you want to go seek the attention of a professional to see if you've got a problem with your sinuses that needs to be addressed. Now, as important as the sinuses are and how annoying they are, bleeding from the ear after a dive is actually a bigger deal, okay? So the ear is a lot more sensitive to pressure injuries, and we've got more high stakes things going on, okay? We've got the hearing mechanism from the cochlea, that inner ear, that thing that looks like a snail over here. And then we've got organ, also called the vestibule, where we're very sensitive to pressure injuries in there. And if you've got blood that's coming out of your ear after diving, though it could be from the ear canal, just a standard old ear canal deep to the ear, it may be from deeper. And if it is deeper, it's something that we need to address with an urgent hearing test and potentially a vertigo test to see if you've done some damage to your inner ear. And there are a lot of ways that we can help you recover that, but we've got to address the problem properly first. So any blood from the ear, go see an ENT immediately, for sure. A ruptured eardrum is something that can happen from pressure buildup in the middle ear, and also can be associated with inner ear barotrauma. And It can be associated with further ear infections from getting water and dirty water inside your ear, from getting bacterial overgrowth. A lot of perforations, luckily, when they're small, they actually get better. If they don't get better, there's some things we can do in the office to get them better and to patch them up. But there's also a lot of people who have ear perforations that we have to fix with surgery. And I do a lot of those surgeries, but I don't want you to get to that point. And infections, obviously, if you have any kind of nasty drainage from the ear, something that looks a little bit yellow on your pillow in the morning, go see an ENT doctor to get it addressed before it becomes a bigger problem.
Okay, so what is it that you're looking for? What are some of the tools that you're using to look at some of these traumas when someone comes in?
Yeah, when someone comes into the office, we use a standard physical exam. We also use a high-powered ear microscope to see, in minute detail, the eardrum and the ear canal. Sometimes we get, little pockets of blood and infection inside the ear canal itself or behind the eardrum, because the eardrum is supposed to be a transparent membrane. So we can see a lot behind it and kind of know what's going on. Is there blood trapped in there? Is there liquid? Is there infection built up? And then I rely a lot on my diagnostic stuff. And in my office, we have amazing audiologists and a lot of other ENTs. They have audiologists who are hearing and balance specialists. And we do hearing tests called audiograms. And we do special balance tests to measure the inner ear balance function. So if anyone suffered any kind of barotrauma, we get a hearing test on them. We do vertigo testing on them, because there's a big spectrum on the severity of pressure injuries, from mild all the way to really, really severe. And we want to be able to properly diagnose that. So I recommend seeing an ENT in your area who's equipped to do those sorts of things, who deals with inner ear stuff, and has, you can look up in the Divers Alert Network, which I'm a member of, who's a good ENT to see. But you want to find somebody who really understands the anatomy and physiology, and then who can actually measure it and grade the severity to figure out how to best help you.
Okay, so this is a very cool procedure that I wanted you to talk about tonight, because it definitely is new and something that maybe a lot of divers have never heard of or even been given this opportunity to listen to. So tell us a little bit about this common procedure.
So one other thing that we do when people come into the office that have issues in the nasal cavity and the nasal sinuses is we use a flexible scope. It's a skinny little camera that doesn't hurt, and it's kind of like a long piece of spaghetti that we put into the nasal cavity to be able to see the drainage areas of these sinuses and to be able to figure out if there's a problem with the sinuses. And also, we can look at the nasal side of the eustachian tube, which is where the nose and the ear connect at the eustachian tube. So if you're having problems with pressure in the sinuses and in the eustachian tube and the ear, what we can do is dilation procedures. Basically, we thread a little wire into those spaces, we inflate a balloon, and we do this under local anesthesia in the office all the time. Patients are awake, we just get them nice and numb, and we dilate open the openings of the sinuses and of the eustachian tubes to prevent future injuries. And it works really well in people who want to continue diving or who have persistent pain and pressure and sinusitis. And we can do it in the office. It doesn't require going under general anesthesia and taking a few days off of work and having a big major surgery. So we call those balloon sinuplasty and balloon eustachian tube dysfunction. And the really, really cool part about this is that they're covered by insurance nowadays. So, you got to talk to a doctor who knows these procedures, but most ENTs are pretty common, are pretty familiar with them. And The eustachian tube balloon dilation is one that I've become really, really fond of because it's a problem that a lot of people don't really realize is a big deal, and now it's covered by insurance. So we've been doing it in the office on a ton of patients, and they have very little downtime. They actually breathe better after surgery, after the office procedure, and they tolerate it so well. In a few weeks, they come back and they say, you know what? The pressure's gone in my ear. I just had someone send me a picture, actually, a free dive patient of mine who just hit his personal record of like 170 feet free diving. And he sent me a picture of his dive computer with that depth. And it made me so happy that I was able to get him back in the water and doing what he loves and kicking butt. So these procedures can really help in the right patients. You just need to speak to somebody who is familiar with them. And if you have any questions about it, you can email me, you can call my office, and we can set up a conversation.
Okay. And so, the last resort, nobody really wants to go under and do surgeries, but what are some of the traumas that you're having to fix people's, problems so that they continue diving, or maybe they'll never continue diving? What are some of the common surgeries you're seeing?
Well, any of these, systems in the ENT world that I touched on, we can have problems with them. So there are people that actually need formal sinus surgery to go in while they're asleep with a skinny little camera, avoiding all incisions, and open up the sinuses a little bit more aggressively, and also improve their breathing, because a lot of the time access and getting air into the nose and to the sinuses is a big part of having healthy diving and getting back to doing, be it diving, or I take care of a lot of pilots who have pressure injuries, or just people who are not divers who are joining us today and they have sinus issues and ear issues. There's a lot of improvement we can make on those patients. People who have had ear issues like barotrauma to the ear, there are certain things that we can do to patch up the areas where they have some weakness of their inner ear. I just took care of a flight attendant who couldn't fly anymore because she was having pressure changes, and she stopped being able to fly, and we're getting her back flying, and she's doing amazingly. I've been taking care of a lot of divers who have perforated their eardrums in the past. They haven't gone back to diving because of that, and we do something called a tympanoplasty, where we use cartilage and a little bit of their own tissue to recreate the eardrum, to reconstruct it from eardrum with a big hole in it to an intact eardrum that moves like it should, get their hearing back, get them back to flying, diving, or just to the activities that they love. So there's a whole realm of surgeries that we do on all of these areas, but the most important thing is just preventing problems, identifying problems, seeking the help that you need with someone who knows how to properly identify and fix that problem, and then going through with the plan, seeing it through to the end, healing up, and then going back to do what you love.
Awesome. And I believe somebody wanted to know about the procedure you were talking about before. They wanted to know, does the balloon, how do you say it? Rhino? How do you say it?
Sinuplasty. Balloon
Yeah. They want to know, will it work if you have allergies?
Yes, that's a very, very good question, whoever asked that. Allergies with sinus problems and pain and pressure, they're kind of like fuel to the fire. They didn't necessarily cause the problem, but they usually cause it to get worse. I generally recommend fixing both problems. So we need to address the allergy issue, because without it, we'd be missing a big problem. And we need to address the physical problem, the drainage of the sinuses, and why you're having these issues. So it certainly can work in people who have had allergies, but ignoring the presence of the allergies and not caring for them and getting them better would be a mistake that might help you prevent you from getting better ultimately. So, we can treat both, and also people who have allergies, identifying what you're allergic to figure out how to actually fix you is super important. So I spend a lot of time with patients, talking with them about allergies, and also about these physical issues with this drainage of the sinuses and the eustachian tube, and trying to get everything under control.
All right. So a question that some people have, a lot of people have kids that dive, and as small children, they get lots of ear infections, especially as babies, and they get tubes put in their ears. Does that affect, people as they get older and they can, want to get in and go diving? Obviously, you don't dive with tubes in your ears, but
Right.
but I mean, does that ever have an effect? Because I hear people all the time, oh, I can't be a scuba diver because I had tubes in my ears when I was a kid. And I'm like, okay, well, what's the answer that you would give on that one?
The answer that I would give, especially with children, if you had a complicated history of ear problems, nasal issues when you were a child, or with your children, if you're a parent who's listening in right now, is these can cause issues with diving if they're not addressed. And with kids, we want to be really conservative. We want to do what's best for them and do things in the safest manner possible. So if your kid has had issues, I would say bring them in, get them a hearing evaluation with an ENT or an audiologist. And if there's any ongoing issues, let's get those addressed before they hop in the water, because we never want them to be in an unsafe environment and cause any issues. Now, in people who have had ongoing issues or had issues when they were a kid, just because you had ear infections and had a complicated history years ago, you can recover. Our bodies are very rubbery in that sense. They can bounce back, and you can have great function even having a complex history when you were a kid. So our anatomy actually changes over time, and that's why we don't get as many ear infections and issues when we're adults, because our anatomy changes. So if you had a complex history, you're probably the right person to see an ENT before you go diving, or if you've had any minute issues, just go see someone before they get any worse. But you certainly can get back in the water, and I hope you get back in the water. And if I can help in any way, I'd love to help you get back in the water.
Awesome. So I have another question coming in. Does grinding your teeth at night affect your ears?
Very good question, and it's a very big misconception in the ENT world. Grinding your teeth at night causes what's called TMJ. What that basically is a grinding. If you think about your jaw, this jawbone over here, as like a shoulder with your arm in a socket. Now, grinding the teeth causes a lot of trauma or friction between the jawbone and the joint, and it causes an arthritis. So grinding the teeth and TMJ is actually an arthritis of the jaw joint. It's right in front of the ear, and it makes it seem like it's actual ear pain, but it's not in the ear. It's just masquerading itself as ear pain. So they're two separate issues. Though it's annoying and painful, it doesn't necessarily represent an ear problem. But it may be important, if you've got a severe case of it, to go ahead and see somebody who can help you differentiate the two, because you might not be able to tell on your own. But if I look in your ear and examine you, or another ENT looks in your ear and everything looks okay, the ear is functioning properly, but you've just got some tenderness over the jaw joint over here, that's probably that arthritis from the grinding.
Okay. So if anybody needs, everybody wants to know, do you do, what was it called? Teledoc? Is that what that's called?
I do. Yeah, we do telemedicine.
Telemedicine, and people want to know, what's your contact information? So funny that everybody is asking, because there it is. There is the phone numbers. You have a practice in both the Broward County in the Hollywood area and down in the Dade County in the Miami area. And there is your email address. So if anybody has more specific questions for you, you can go ahead and reach out to the doctor. Or if you want to start seeing him, you can call one of those phone numbers and go and make an appointment, and he will definitely make sure to see his divers, right, doctor?
Yeah, absolutely. I found that, getting into diving even more deeply, and then, learning some new techniques on helping people recover and prevent new sinus issues and ear issues, and tying that in with my own diving experience has really helped me, be able to address problems in a way that I maybe necessarily couldn't when I came out of training. So I've picked up a few tools of the trade. We've got really interesting and amazing technology that's out there to do things really safely with patients now, using image guidance and minimally invasive office techniques that allowed us to, open up our array of tools to help patients out. So I take care of, I see patients for international telemedicine conferences. I see people telemedicine who live in the US, and I'd be happy to set that up if you have any questions or concerns but are not in the area. I'm also very reachable via social media. I've got an active Instagram account. I'm on Facebook. You can, look at my website. It's greatermiamients.com, which, Nicole or Forsey can share with you guys. But it's really been a blessing connecting with the dive community because, I've been able to help people get back in the water, and I've been having a lot of dive instructors give me tools to improve my own diving. And I've been able to share that with friends who have had some real emergencies after diving, getting their hearing back after sudden hearing losses, getting them back from the brink of quitting diving because of pressure and pain and, discomfort. So it would make me happy to help you get back in the water and do what you love. And, it's just been a blessing. So I'm available, and you can find me. I promise you can find me, and I will get back to you and we'll set it up. And if I can help you, please let me know.
Awesome. Well, thank you everybody for tuning in, and thank you, Dr. Grobman, for this fantastic presentation. I think we got a lot of great tips and tricks about equalizations and how to prevent and how to, make sure that we're staying healthy so we can get out there and go diving this summer. I mean, it's wonderful to be able to have somebody who not only is from the medical community, but, you're also a diver, so you're able to, tell us, what it is that we're experiencing, because there's a couple of people who wrote on this chat. My ENT told me when I told him I was having problems clearing, that I should stop diving. We don't want to do that, right? So if you guys do have an ENT that doesn't know what their experiences with diving, and you want to keep diving, give Dr. Grobman a call. He would love to see you and get you either back into diving or get into more healthier ears and sinuses. So all right, so we definitely are not done. We need to make sure that we give away that $50 gift card to 4C, right, everybody? So let me go ahead and pull the random name picker over. If you registered online before 6:45 on our Eventbrite, I grabbed your name and your email and I put it into the random name picker. We're going to raffle that off right now. Okay, so whoa, here we go. All right, so there it is. Actually, Dr. Grobman, I'm going to hide you for 1 second so people can see. Okay. All right, everybody, there's everyone's name, and let's see who our winner is. And Elon Lax, I think. Ilana Lakes, maybe. I'm sorry if I'm butchering your name, but Ilana Lakes, you are a winner of our $50 gift card to 4C. I'm going to send you an email, and you can tell me what store you want to pick it in from, and you can come shopping at 4C, and we'll get you some gear to go diving. So let me bring the doctor back in, and there he is. All right, guys, so that is the presentation for tonight, and we want to thank you guys again for tuning in. And make sure that you are tuning into more events. Go to www.force-e.com, go to our event tab, and check out and see what we're doing. We've got lots of dives and Facebook presentations scheduled, and tune in because we might be doing some in-person events these days. We need to bring back our bowling, our trivia. We got to bring it all back. Now that the country's opening back up, we'll be able to host some fun events for you guys soon. All right. Thanks, everybody. Thank you, Dr. Grobman. Everyone have a great evening. See ya.